Hello, myself Priscilla Maria Anil. I'm an NLM student in Seneca College. My group consists of myself, Pheba, and JAISEMOL, and we had done a project on political advocacy in NLM 205. This presentation is all about our project. The risk population which we chose for our project was Indigenous population in Canada. It's because they suffer from a lot of health inequities, and this is mainly because they were relocated from their inhabitable places into uninhabitable places by colonial powers, which happened years back. And this also led to various kinds of discrimination in all phases of life. And these are the main reasons why they face a lot of problems nowadays. And in this project, we advocate for indigenous populations in order to meet their health needs. Let me give a brief description about our project. Our project was in political advocacy, and the high-risk population was indigenous population. These are a community which occupied the country even before establishment, and they still preserve all of their social, economic, cultural, and political system. And we choose indigenous people for our project because they had a lot of problems like literacy, unemployment, poverty, and landlessness, hygienic issues, and they acquired a lot of diseases like TB. So we had a few interventions, and the main focus was on health teaching programs, which covered various topics such as vaccination, sanitation, healthy diet, exercise, etc. These were supposed to be given by healthcare professionals like nurses or other people from the medical profession. And some of the other interventions are media campaigns, medical camps, screening camps for various diseases, perinatal checkups, and various subsidies for indigenous people, for example, food subsidies. There were many reasons why we choose this population, and some of these reasons are unemployment, illiteracy, and high rates of suicides, inadequate housing, sanitation, and poor income levels, then food insecurity, lack of nourishment, and there were high rates of infant mortality and children's mortality rate among this population, and they were not much accessible to health facilities. And one of the main reasons is that they were having high rates of tuberculosis among them. So these are my topics, and the next topic will be covered by JAISEMOL. Thank you.
Hi everyone, so I'm continuing with patient advocacy for indigenous population. Here comes the theories and strategies. One of the theories is Salmon White's construct theory. It says that participants are encouraged to modify their attitude and behavior voluntarily through education, and some of the strategies that we can implement in the indigenous population for the betterment of their physical, social, and mental well-being are chronic disease prevention, environmental and occupational health, immunization, injury prevention, knowledge exchange, health promotion, communicable disease control, and infection prevention. Then, when coming to ethical consideration, all healthcare professionals are supposed to respect others' values and beliefs while providing care and as well as health education. Nurses can avoid ethical conflicts by understanding and respecting others' values and perspectives. And according to CNA 2017, nurses must respect the special history of indigenous population, which is articulated in the Truth and Reconciliation Commission of Canada. Nurses are expected to provide proper care to all, regardless of age, race, gender identity, sexual orientation, disability, and others. And no discrimination should be shown while providing care. Then, some health promoting outcomes among the indigenous population that we would like to see as a group are adequate health for all, improved environmental sanitation, basic education, food security, adequate housing, equal employment opportunities, and reduction in their suicidal rates and accessibility to health facilities. So that was my topic, and the rest will be continued by Pheba Anish.
I am Pheba Anish. Today I am going to discuss about the plan to evaluate the anticipated outcome in our political action, advocacy in Indigenous population. First of all, as a nurses, we have to work with the families, individuals, and communities to understand their social determinants of health. It is really essential to understand their social determinants of health, such as income, education, family background, etc. It helps to understand their problems, and we can work along with them. We can work with them to reduce their problems. And we conduct the survey to evaluate the outcome evaluate the outcomes by adequate history collection, physical examination, and interviews with the indigenous population. It helps us to understand our advocacy really help for them. So the history collections helps us to understand more about their anticipated outcome, and physical examination as well as the interviews with the indigenous population. Then screening camps for diabetes, TB, and hypertension, which helps to control these issues. Indigenous populations are really vulnerable group of people, so they are more vulnerable to such diseases, because the TB ratio and all is more in indigenous population compared to non-indigenous people. And antenatal and postnatal checkup helps to reduce the morbidity and mortality rate among the mothers and the newborn children. And along with the nutritional assessment helps us to know about all of their nutritional needs are met or not, and we are providing some nutritional supplements and vitamin tablets for them. And blood and urine investigations helps to understand more about their problems, as well as mental health assessment to prevent the suicidal rate. That in our survey we know that the suicidal rates among the indigenous populations are really high, so it helps to understand more about that. As a group, we learn by working with the indigenous population, especially we learn more about the lifestyle of the indigenous population, and we recognize the problems faced by the indigenous groups. As I said earlier, that indigenous people are more vulnerable for the disease conditions because of their lack of knowledge, lack of availability, and so on. And various researches shows indigenous groups are vulnerable populations and more prone to get diseases due to their lifestyle, especially the high statistical rates of suicide and TB among this indigenous population. So as well as providing health education and screening measures to prevent the disease and promote health. Uh, Public health services to support the indigenous people. There are Public Health Ontario really support this indigenous group of populations, and to support them by providing various necessities and advocacy for the indigenous population to obtain an adequate health. And as an advocate, working with indigenous people helps to improve their overall well-being by providing adequate health education on the importance of access to the healthcare system, proper sanitation, adequate nutrition, vaccination, and screening measures to prevent the occurrence of disease and promote health. So uh, as an advocate, we working with this population. It helps us to reduce their problems in some certain extent, and educate them about the importance of keeping their health properly. These are our references: Canadian Nurses Association Code of Ethics for Registered Nurses, College of Nurses of Ontario Practice Standard Ethics, Current Nursing, Nursing Theories, DAT-CG, Asiatoyal, Akins, AD. And next is Indigenous Corporate Training, Public Health Agency of Canada, Public Health Ontario, Savage C, Skinner H, Hanning Aram, Desjardins, Tusney, University of Lapan, Definition of Indigenous Population. Thank you.